Good evening and welcome to Hot News. We are live on Pan-African Television. We are also live on Facebook at Pan-African Television. We are coming to you from our studios in Abilinkwe 48 Swanika Street here in Accra. You can join in the conversation by sending in your views, comments and contributions on WhatsApp stroke text line displayed on the screen. We'll make a time and read all those out for you. You can as well leave your suggestions, questions, and whatnot on our social media pages. I'll read all those out for you. Let me say a very good evening to all persons watching us on the 48 African countries where Pan-African Television is watched. My name is Justice Appiah once again, and tonight on Hot News, we are looking at the 2022 budget statement presented by the Finance Minister with the health sector in focus. You know, the debate has started on the floor of Parliament with both sides of the House, you know, probably coming up with some very interesting, you know, debates and all of that. But the ranking member, I have a video to play, and the video has to do with the ranking member on the Health Committee in person of Honorable Minta Akando raised some pertinent issues on the floor of Parliament whilst the debate was actually ongoing. Let's go and listen to what he has been saying. I'll come back and introduce my guest for the discussion to start.
Dishonesty. Mr. Speaker, again, I see that is not enough. If you go to the 2021 budget, 996, Mr. Speaker, a number of health facilities have been listed in paragraph 996 of the 2021 budget as projects that they are continuing, Mr. Speaker. These projects, again, have been listed in paragraph 1014 of the 2022 budget as yet to commence. Something that you were continuing in the 2021 budget, now in the 2022 budget, you are telling that you are yet to commence. Dishonesty. Mr. Speaker, the dishonesty in this government is becoming legendary, Mr. Speaker. Mr. Speaker, and such, I will give examples of such projects. The Tamajenua Hospital, Shaman District Hospital, Lajenua Hospital, reconstruction of Nkwaza Hospital, Accident and Emergency Center Adoma. Mr. Speaker, these projects were repeated in 2021 budget and 2022 budget with different captions, Mr. Speaker. And we cannot retrogress, Mr. Speaker. Mr. Speaker, again, after talking about Agenda 111, the expectation of every Ghanaian is that we will make plans to recruit more health professionals in the health sector. The Speaker, clearly it is missing in this budget. The Speaker, we will need specialists for the hospitals. The Speaker, it takes an average of 3 years to train a specialist. So your first budget at the cutting sword should give that direction. The Speaker, the worst form of it is that the total staff strength of the Ministry of Health in 2001 budget stood at 251,527. Now, after counting Agenda 111, that it should increase, the Speaker, it is now 203,000 people. It has reduced a difference of about 43,000. The Speaker, why are the people doing? Mr. Speaker, 43,000 people are retired. Interesting. Mr. Speaker, again, the impression created at paragraph 1005 is as though Ghana has just discovered e-health, and we should allow our vice president to be touching everywhere that Ghana has just seen e-health. Mr. Speaker, I will prove to you and this House that the e-health was actually started by the visionary leader, His Excellency John Dramani Mahama. Mr. Speaker, the e-health was started in 2013, in 2014, and Mr. Speaker, in the 2015 budget, the minister responsible for health then, Honorable Setepe, had this to say. Mr. Speaker, with the permission, I read 2015, Minister for Health, Minister for Finance, had this to say. Paragraph 521. Mr. Speaker, the ministry through NITA embarked on the deployment of an enterprise-level hospital administration, radiology, information and communication systems for managing the healthcare provision needs of Kolebu, Wa Regional Hospital, Zebila District Hospital. This centralized electronic medical record system will provide unique patient ID that can be used by a patient to access medical care nationwide. This is 2015 budget, which is available to this House. Mr. Speaker, progress that were made in 2013, in 2014, in 2015 were all reported in the 2016 budget. Mr. Speaker, again, with your permission, I read. And this is what the Minister responsible for Finance, Honorable Setepe, had to say. Paragraph 590. Mr. Speaker, in 2015, the Ministry continued to deploy e-government applications in government establishment as part of the e-transform project. Mr. Speaker, these include the One-Stop Service Center, e-immigration, e-cabinet, e-parliament, e-justice, and e-health. These are the evidence. Mr. Speaker, all these things were done. What His Excellency John Dramani Mahama didn't do is to impose electronic transaction levy. So, Mr. Speaker, if they think that they do not know what to do, Mr. Speaker, to develop this country, it is not by force. Mr. Speaker, they can leave the good people of this country alone.
Well, that was the ranking member on the Health Committee in Parliament, Honorable Minta Akando. But as you know, the negative impact of the COVID-19 pandemic is still being felt on Ghana's economy since the outbreak of the early part of 2020. Several health initiatives have been introduced, particularly during the 2021 budget presentation, to improve healthcare delivery. You know that the 2022 budget, of course, read by the finance minister, is not too different from what government said it was going to do in the 2021 budget. For that reason, I've been joined in the studio by the deputy ranking member on health, on the Health Committee in Parliament, in person of Dr. Mark Kurt Nawani. He doubles as the Member of Parliament for NAPDAM. Honorable, good evening.
Hello, good evening.
Thank you so much for joining us on the show tonight.
And thanks for inviting me.
How's the constituency?
Yeah, everything's on course. You know, as we always say, Fumaeshi. So everywhere, including my constituency,
I see.
I show.
Anyway.
But all the same, we are there, and tomorrow I'll be leaving for a festival, if possible, if we're able to close early.
Right.
Because actually, now Parliament, you can't just leave like that.
Okay.
Yeah. Because we've got to take decisions, etc. And then you've got to be present to contribute, you know, your quota. Yes.
Right. Okay. Now let's move straight to business. As the ranking, as the deputy ranking member on the Health Committee in Parliament, you know, I would not want to look at the 2022 budget statement in its entirety. I would want us to look at it with a focus on health and all of that. Are you satisfied with, I mean, the allocations and what government has apportioned in terms of health in the budget?
I will find time and come for us to discuss about the details of the allocations. But I would like to, for now, limit myself to the policy.
Right. Okay.
And then the policy statement.
Very well.
And that is what I think you showed my ranking on the floor of Parliament debating. Very well. Yes, on that day, I think I was the second person to debate on our side. Yes, and then the minister also spoke, and then I think the chairman of the committee also debated.
I see.
Yeah, but what I realized was that majority of them, especially from their side, they were not ready to debate the health issues that are in the country. They just went around the issues and was debating on the economy. But there are real health issues that we need to look at. The government policy statement is continuously changing because as if they are running away from the issues. If this year we raise these particular issues, the next time you will not see its continuity in the budget.
Which issues were raised in the 2021 budget,
for example,
that did not, find its way into the 2022 budget?
For example, we always say that for us to be able to assess the outcome of the health services, we need to move to the clinical indicators. In other words, we should have things like the maternal mortality,
right?
The ANC attendances that we now have. They say we should have a minimum of 4. We should have child mortality, under 5 mortality, the incidence of malaria, etc. Whether our fight against malaria, the fight against the rollback of malaria, whether it is on course.
Right.
All these things have to be shown in the form of data, and that is the output, because the input is the money and other things that we put inside. The input is the human resource that we employ. The input is the infrastructure that we build, but the output is what we want to see, is to see some of these indicators moving down,
right?
And that our women do not go to deliver and don't come back home. This is what is important for us, and they don't bring these indicators anymore. They just remove them. They are silent on them. They shelve them off, such that you can't even assess government policy rightly. And there are also some if you go to the NHIA reporting, they used to report not only on the enrollment, but the active participants, those who really go to the hospital with the card. So enrollment is different.
Right.
Once you've ever gone there to register and renewed, you have been enrolled. So you are part of the people who probably have heard about the insurance system. But for the active enrollment and participants, there are those who actually use the card to go to the hospital. And that figure is usually, the last time it was reported, that was last year or last 2 years, the difference was about 5 million. Where people who had the cards, about 5 million of them were not going to the hospital. And that phenomenon we call churning in health insurance. You know, I did my research work at the master's level on healthcare financing.
Right.
Yes, and one of the things I did was health insurance, social health insurance.
Right.
Yes. So 5 million people were not using their card to go to hospital, and this we had to now try to find out what is happening. And somebody has the card, and he's going to the hospital, and he's not using it. And so there's the need for us to have consistency in reporting on government policy. Having said that, I would like to go straight to, I think, the most common thing that all over the years we in the health committee as a group have been fighting against, and that is the uncompleted health buildings or the hospitals that was started by the previous government. I mean, the NDC government and President Mahama.
Right.
And what is their status now? You find out that if you go to paragraph 1001
1001
of the health policy
okay
statement, It is written that the ministry is developing a hospital infrastructure strategy to bring clarity on infrastructure planning. That is, they're developing what? An infrastructure strategy that will bring what? That will bring clarity on infrastructure planning. When you see this, you think that yes, we have arrived there. They've seen that there must be planning in our infrastructure development. And the president, in his State of the Nation address, also said that priority should be given to uncompleted projects in all ministries.
Has government not given priority to completed projects in the country?
That is where we have the problem.
What are your problems? Which, health projects did you start that this government has not completed?
That is where we
has not worked on at all?
Now, suddenly, in the previous budgets, some hospitals were always mentioned,
right,
and given 70% completed, 75% completed, and suddenly in this budget they have disappeared. Some of them include the Kumewu, the Fomena, Abetifi, the Afale military hospitals. That I think my ranking mentioned them.
Right.
And in fact, I would have thought that by now they have finished these hospitals. But recently we went round. I don't know whether you heard you heard about us. Well, we went to a hospital where the military, some military men were not allowing us to photograph and video the planes, and they wanted to sack us.
Right.
But we visited all these hospitals. Abetifi, Kumewu, Fomena, and Afare. So they still remain incomplete.
So, Doc, under health, this is what the finance minister said.
Yes.
And if you look at, is it paragraph 134? It says 124 district hospitals, 7 regional hospitals, and 3 psychiatric hospitals have been, sites have been identified, completed, and work has begun on those hospitals. Isn't it a plus for the sector as a whole?
Yeah, I'm just coming to it. So we have these hospitals that have been in the budget since 2017 to be completed. Then suddenly they disappear. They are silent on it, and they have not completed them.
If you listen to the finance minister, he said that sites or plans for 91 district hospital sites have been completed.
I think the 134 he's mentioning is probably a mistake.
No, he said 124.
124?
Yes, 124 district hospitals, 7 regional hospitals, and 3 psychiatric hospitals. Cadastral plans for 91 district hospital sites have been completed, and work has begun on X number of sites.
Yeah, you see X number of sites. The X is a variable. And that means that at the time of coming to deliver the message, he had no information on that. That's from the day of that statement. There's a problem there. We talk of Agenda 111, and we talk of 101 district hospitals. We talk of 3 psychiatric hospitals, and we also talk of 7 regional hospitals, 6 plus 1. 6 regional hospitals, then 1 for rehabilitation, and that is Appiah Kwanta.
Right.
Yes. So it's 111 that he wanted to probably quote.
Exactly.
Yes. But apart from that, actually below, when you go to the budget statement itself, it's stated that there's 11 number 40 hospitals and 1 number 30 bed hospital, 11 number 40 bed hospital and 1 number 30 bed hospital to be built in Bono, Greater Accra, Ashanti, Eastern, etc.
Honorable, is the minority in Parliament not being too critical on this government? Is it a case that you are not allowing government the space to operate, especially when it comes to the health sector? They promised 111, hospitals and all of that. Government says out of that, you know, plans are far advanced for about 91 of those to kickstart and all. Why don't you give government the benefit of the doubt?
Last year they were speaking about plans being far advanced, and that they had even awarded contracts. This time it is stated in the same budget that the 101 cadastral planning has been made, which means that possibly the land,
yes,
and then the architectural drawings have been made.
Right.
And first, you have uncompleted projects, which even the Coalition for NGOs in Ghana listed almost about 60 of them. You have them as uncompleted. You have Agenda 111 as another project that you have started, and it means that you have already done the architectural drawings and then possibly the landscaping, etc. Now, you've not finished with that. There are also some hospitals, of course, that when the funding has been secured. It was secured under President Mahama. Yes. But you have new hospitals. Look, the 111 is different.
Right.
You have not done much about it. You are now packaging new hospitals. 11 number 40 beds and 1 number 30 bed hospitals. In addition, in Ashanti, Bono, Greater Accra, and Eastern.
Okay.
Why? What is the problem? Isn't it better to complete one hospital and use it, commission it, make it operational, and let it serve people? Now, than having about, should I say, from what has been written here now, we have 11 plus 122 hospitals. Now, that is going to be built.
You have delved into the, you know, the argument
yes.
of abandoned hospital projects
yes.
and all of that.
Yes.
And I'm sure you're talking about those that were left behind by the Eswal Mahama administration.
Yes.
Fantastic.
5 years into their distance, they are here to build
for viewers to appreciate the issues properly.
Yes.
You are in a better position to tell the number of hospitals you initiated under your watch, those that you had secured funds for, those that you've been able to complete, and the numbers that are left for this government to complete, and the numbers they've not been able to work on. Do you have that information?
I know that, you know, quite a number of them were started by President Mahama and completed.
How many?
If you take, look, all the hospitals, Cape Coast, Sunyani, etc., the regional hospitals. I mean, you know how much work was done at Tamal. Even Bolga, we have done some work there. While I don't want to go back to list all our achievements, but I want the people of Fomena. You know, that is the constituency of the deputy speaker of parliament, the second deputy speaker, the independent person there. I want the people of Fomena to understand that, look, we are fighting for them. So what is actually, my problem is that 5 years down the lane, some of these hospitals which were started so many years back are still not being done. Meanwhile, effort is being made to build new ones. And the new ones, let me tell you, if you listen to the stories that are coming out, you will not be happy. For example, when we made the Association of Architects in Ghana, they were not happy. They have a number of about 3,000 or so in Ghana here. They are even up to 3,000. And they have the expertise. And do you know that all this 100, Agenda 111, all these 101 hospitals was given to only one person, one company.
I see.
Or one architect to draw. Why should it be so?
What's wrong with that?
What is not wrong with that? The three people will say that it is Jawa and we have an association. We have this big work to do. It is not referred to even the association, or the association is not invited to bring bits, or individuals are not invited to bring bits.
Right.
You go for sole sourcing. Why should you sole source? Building of hospitals is not like your own individual or personal project. When they wanted to build a cathedral, they sole sourced it. Has anybody spoken about it? No. They said they are doing their own thing. They are not going to use government money. But you cannot use government money to build, and then you do your own thing. No, it's not possible like that. Once it is government money, you know, you can't just give it to a friend or something.
Oh, they
are giving this project once again to the person who is building or who did the architectural work for the cathedral.
Oh, you are the deputy ranking.
Yes.
Right. You've had several opportunities to, you know, summon the health minister, you know, on the floor of parliament to answer certain questions pertaining to some of these abandoned, you know, what are some of the reasons they've ascribed for not being able to complete the health project you've left behind? Your government, you know, has left behind.
Oh yeah, they are always shifting the goalpost. Initially, it was that they want to carry out forensic auditing of the contract that was awarded to those individuals.
But here's the case: new contracts have been awarded,
yes,
you know, for new hospitals to be built for 5 years. I mean, by now, forensic audit should have been, you know,
exactly,
should have been over.
Should have been over.
You know, the project to continue. So there must be some questions to answer.
And
what have you done as a ranking
when you leave
to get appropriate answers to those questions?
We have pursued this case with even the help of the media, who follow us around and make sure that they take some pictures, etc. We have presented our report to the ministry, and they know our stand on it. That, look, in most of the places that we go, I'm telling you that the facilities have been left to deteriorate to the extent that there's the need to do what we call repackaging. Repackaging. In other words, unless some extra money is paid, is added to the original contract, probably the contractors will not be able to, because we went to some places, you know, even their store of material, somebody tried to bend them. We've gone to some places where what they built over the years, they got to a stage, I believe they were asked to leave, to stop work. And so when they stopped, now the rains have come and they've removed the roofing, etc. So there's the need for repackaging. I bet if you like this, it was very, very horrible. You know, some of the buildings have been pushed down by the rain because they were fabricating it.
Right.
And once they were fabricating it, it got to a stage and they asked them to stop. And they had to stop. Possibly reinforcing it was not done. And so things have gone bad.
Oh, but we cannot discuss some of these issues, and especially abandoned projects.
Sometimes we consider all these things from the point of rationality. But the government is rational.
Right, but I'm saying that...
And then we are dealing with the rational government.
I'm asking that...
But unfortunately, that is not the situation.
But we cannot discuss these issues without also talking about or taking into consideration the challenges this government is confronted with. Like the COVID-19.
The COVID-19 was just last year. Our shutdown was for 2 weeks. The number of people who died out of COVID-19 is just recently got to thousands. You know, or 1,000, not even up to 2,000 yet. The road accidents we have been getting is more than the road deaths from road accidents. Yeah, it's more than what we
so basically, if you're talking about abandoned projects and the fact that this government has to do something about it,
yes.
Well, you should also know that there are other things when it comes to the health sector that the ministry, of course, or government would have to prioritize. For instance, purchasing of vaccines, you know, when we went to the
that was just this year.
There were lots of things that government had to consider to make sure that the lives of Ghanaians are actually saved and all of that.
Yes.
So we cannot hold government accountable entirely for not being able to complete some of these projects.
No. Government cannot run away from this.
You mean that government cannot run away from it?
No. And in
what makes you think so?
Because we are talking of projects that funding was secured.
Are you saying that all the projects your government has left behind,
yes,
you know, of course, had its own funding?
Yes, funding
and it's a matter
secured.
of government continuing.
It's a matter of supervising.
Right.
Yes, supervising. And when you are supervising, it depends on the decisions that you take. If you tell them, if you encourage them to go on, they will go on. If you tell them to stop, they will stop. Because at that point, the NPP government was supposed to take over the payment in installments to these contractors. That was all. They were not supposed to look for money to complete these projects. No. The money were escrowed. They were in the bank. Barclays Bank, etc. were all involved.
If the funding was ready,
yes, so
why didn't you finish those projects? For Mina, for instance, the NDC government could have finished that project. If indeed you had funding,
yeah, they had funding.
Why didn't you finish?
They had funding, but it depends on it was awarded just a year to elections.
Right.
Yes, but once the funding was secured, we started the work. And they got to about 70%. In fact, if you go to Formina, if I was the owner of Formina Hospital, I would have started since long. All the buildings, everything is there. I would have started since long. It's only because it is for government and possibly there are rules and regulations that you've got to observe or sit down with the contractor and see how much you pay him. But honestly, you can today kickstart Formina Hospital with staff bungalows for doctors to stay, very nice ones. 3 bedrooms accommodations for doctors and nurses and other medical staff.
Do we have
medical
equipment?
Equipment are in the room. I can see them. The beds, etc. are in the room. I can see them. And the tables are all in the room. I can see them. So, and if you go to Afari, the same thing. The oxygen cylinders, etc., are on ground. And if you don't, when you see all those things coming in, it means that they are about to finish. Afari Hospital can be started once all the other problems are being solved.
Right.
So let us. I don't want to spend all the time on the infrastructure.
Very well.
But I would say that what is the rush in trying to build new ones when the old one? Look, you started Agenda 111. You've not even secured the funding properly. You are bringing in new hospitals in again. They'll soon give it a different name, or they'll add it to Agenda 111 to be Agenda 122 or something of the sort. But already the idea of building new hospitals,
right,
and awarding new contracts are there. But let me go to a second issue.
What's the issue?
And recently, I think that you heard about Vice President Bawumia's lecture on at Asheshi.
Yes.
And that was the first time, I was hearing him speak about this the digitization.
Exactly.
And especially on the health sector. He was so emphatic that this government is doing well and that they are bringing what we call electronic record keeping system.
Yeah.
Initially, I thought it was something that was new, that was coming, that we have never seen before. So I started calling my friends in the ICT department and those working with us to find out. And I'm telling you that this electronic record system has been with us since 2009. In my hospital, 2009, Infotech dot system provided us with this service where we could keep all our records. You see, when you go to the hospital these days, you see them, they'll key in your particulars. You know, when you go to a doctor's office, they're keying in your the clinical findings, etc. We use it to do registration. We use it to manage our clinical records. We use it to manage our financial records and even stock keeping. When we buy drugs and we issue them out, we are using that particular system to do the work. We call it HAMS.
Right.
HAMS, Health Information Management System, you know, or something of the sort. And the vice president was there, and he was telling us that something new has come and that he is leading the fight to bring in what? Digitization into the country and the health sector. This is what they have done, etc. Now it came out that that is not the case. What is happening is that the Ministry of Health and the Ghana Health Service have found a company that now all this work that was being done by various service providers, they are stopping all of them and giving all the work to one company. Why so? And so the vice president had to come and tell the whole world that something new is coming.
Right.
Why so? I asked, when I was telling you about the architects, you know, I'll tell you about the architects. You asked me whether is there something wrong with this? What about this too? This one day, we're already in existence. 2009. So many service providers. Dunkwa Hospital had their service provider, ICT providers, their system providers. Obuasi Hospital had their own. Right. Tech had their own. And it was like a market. There were even instances where I thought of changing my service provider because I thought that somewhere it was cheaper. We pay a monthly rental bill. Yes. And suddenly, this issue comes in. All other service providers are made redundant. Everything is given to a company that is called, I think, is it Lightwave? Yes. A company that is called Lightwave. Right. And they have done it in Cape Coast and 60 other hospitals. And I asked myself, why is it so? Because when we do this, we are creating a monopoly. When we do this, we are creating unemployment. Because all the other systems used to employ people. And now you are suddenly telling them that no, all the investment that you have made over the years, if we are talking of 2009, we are talking of about 12 years. You know, all the years that you have invested to build your system is a waste, and that your work is no more needed, and that a new contract worth hundreds of millions have been awarded to a new company, and so you should all wind up your activities. I mean, if the hospital, Ghana Health Service is the biggest healthcare provider, and if they are taking away your customers from them, then what is left? I mean, the private sector is there, but we are a small number of people.
I see.
Yes. And so sometimes, and this is, in fact, it is on paragraph 1005 of this year's budget. And when I saw it, I now started making inquiries about it. And I realized that they have even petitioned the minister on this issue, and the minister's response was that it was too late for him to do anything. But I must say that as a nation, we should be careful about this creating monopolies.
Fair.
Can you imagine that the whole country, Ghana, our health records is likely to be managed by just one company? And when that one company is not happy, I know they'll get to a time they will not be happy, because whatever they have received now, they are happy with it, but it will get to a stage where the rentals, the payment of the rentals, etc., can delay. And if they are not happy, it means that when you are dying at, or when I am dying at Konfirmation Teaching Hospital, and they need my records, which was at Dunkwa Government Hospital or some other place, they can't get it because the service provider is on strike or is not happy.
Right.
Or has terminated the contract, or is asking for payment before he continues to provide the services. And there's only one company that has the records of the whole Ghana. That is going to be, a real monopoly.
We have to get going, Honorable,
yes,
at times.
okay.
Yes, I mean, unfortunately, we couldn't start on time.
Yes, but I want to touch on the
time.
last
issue.
Briefly. Yeah, on the last issue, and that is the healthcare financing.
Okay.
A lot of people, when they are talking about the problems that we have in the health, they are likely to mention the infrastructure,
right?
The human resource. We don't have doctors, we have nurses. They might even talk about the lack of equipment and laboratory.
Exactly.
As the problems that we are facing. But the true issue is our health financing system. Our financial accessibility to health is deteriorating. I don't know whether recently, if you are a young man, possibly don't go to hospital. But these days, no matter what you do, when you go to hospital, you have to pay something.
Despite you have insurance,
you have to pay something. Just try it and see. Just take your card, move to Achimota Hospital and see. They'll give you some people go. There's a bank. You see now what they have brought. What is there is that
probably you have to pay for the services that the health insurance is unable to cover. Apart
let
from
me tell you
the
truth. I'm a service provider myself.
Right.
95% of these sicknesses that we have here is covered by health insurance. 95 or more is covered by health insurance. What is not covered by health insurance is very, very small.
Okay.
And most often, you are likely to face it when you go to a teaching hospital. But even a teaching hospital is the same thing. Go and say you want to extract your tooth and see whether they will not show you a bank outlet that you have to go and pay.
So you mean that some hospitals are charging people?
It's not some hospitals, practically.
Practically.
All
people are charged.
Are involved. And it is not the fault of the hospital.
It could be private hospitals. I don't think
private hospitals, government hospitals, quasi-governmental. Go to 37 military or a police hospital or any other place.
Right.
And it is creeping in. The cash and carry is creeping in. And we need to let them know that there is something wrong with the system.
These are issues
the big players have to sit down. The Ministry of Finance is not giving all the money to the National Health Insurance Authority. Last year, it gave them about 67%.
No, these are issues you have on record. These are issues you are privy to.
Yes.
What is preventing you or any other member on the health committee in Parliament, summoning the health minister before Parliament to answer questions on some of these things?
We're doing our best. We are doing our best. I mean, I think that the health minister in his delivery yesterday said that he's one of the he has been so much bastardized in this country,
right?
That so that tells you that we are doing our best. But whether they will listen to us and sit down and talk, service providers, the Minister of Finance, the Minister of Health, the National Health Insurance Authority, where they sit down and talk about these issues, because cash and carry is creeping back. What they don't want to call it cash and carry. You know the new name that is used?
What's the new name?
Co-payment.
Co-payment.
Yes, or top up. Okay.
Right. So the question is, we have to get going.
Yes.
But then my final question to you is that what do you think might be the reason why cash and carry would be creeping in? Is it as a result of is it as a result of the fact that the service providers, I'm talking about the health insurance, policy, is it as a result of the fact that the service providers are not paid? Or what is bringing back the cash and carry system?
Means what it means, you see, there is some uneasy silence about some of these issues that I'm not happy about.
Right.
And what it means is that the service providers are not being paid well, but they are being described as fraudsters. National Health Insurance Authority. The service deliverers themselves call whatever payment that they take as a cost recovery levy.
Okay.
Do you get me? They are described as cost recovery levy.
Right.
That is the Health Insurance Authority are calling it fraud or overcharging or any other thing.
Right.
Or co-payment. And also trying to recover part of their money.
Okay.
But in the long run, it means that there is dissatisfaction with the tariff structure. What the health insurance people pay to the service providers, they are not happy with it. They are afraid to talk about it because of the way the National Health Insurance Authority and then the government, the position they have taken. Because when you are targeted,
right,
I mean, you suffer for it. So they are not talking. And the Minister of Finance is not also even releasing all the money to the Ministry of Health or the National Health Insurance Authority. And they're also keeping quiet.
Okay.
They're also keeping quiet. They are afraid. When I say afraid, the Minister of Health...
provider, for instance.
I'm a service provider.
You also have no other option than to
no.
people from coming to the hospital. Is that what you are saying?
It's not only it's not now. The issue has gone beyond late payment.
Right.
The issue has also to do with inadequate tariffs.
Okay.
And this too is now bringing in what we call the cash and carry. And when you ask the service providers, now they don't call it cash and carry anymore.
Okay.
Yes, now they call it co-payment.
Co-payment.
Or top-ups.
You mean that the top-up or co-payment is the same thing?
Cash and carry, exactly. Exactly.
Well. Thank you so much for coming. Absolutely.
Okay.
Please, your time allows the program. Make a time with me.
Yeah.
Same time next week. My name is Justice Appiah. I apologize for not coming your way at exactly 9:10. Unfortunately, it was a situation beyond our control. But kindly forgive us. Goodbye.